Okay, good morning, everyone. We've got a lot to get through today, so we'll get going quite promptly. So yeah, welcome to today's webinar on STATS19, and we're going to be talking all things STATS19. So we're going to look a little bit at the past and some previous research that's happened, what's currently happening, and then a bit on the future, covering data developments and future directions. So lots to get through. If you're somebody that likes a webinar that is fast-paced and covers lots of different topics, then this is the webinar for you. If not, then there'll be a recording afterwards and you can digest this at your own pace and go through a little bit slow with some of the slides. Okay. So today's webinar, I'm your host, Nathan Harpham from Agilysis, and we are joined by 3 guests today from the Department for Transport. So we've got Matthew Tranter, Megan Turner and David Clark, who are all going to present to us on different bits of STATS19. The webinar is going to last for 1 hour and we will use all of the hour, I'm pretty sure. Please, as usual, use the chat for comments as we go and the Q&A function for any questions you have. If we have time at the end, we'll ask 1 or 2. We're going to have quite a lot of active participation in today's webinar. We want your opinion on various different topics. In order to do that, we're going to be using Mentimeter, which hopefully some of you will have used before at least. There's a QR code here. There's also the website menti.com. So if you go to www.menti.com or scan the QR code and use the code 31869867, you should be able to get yourselves set up for the questions that we're going to ask you. And we'll put a link to menti.com in the chat as well. So I'll just give you a minute to get that sorted before we get going with the content. The code will come back on the screen when we get to the individual questions. So this isn't your last chance to get onto Mentimeter. Right. So yeah, today I said we're going to be covering lots of different topics. We'll start with looking at some recent work that's happened. Then we'll look at publication plans for 2025, and then a little bit into the future. And at each 3 stages, there'll be questions for you to engage with on Mentimeter. So we've got 10 questions in total, so plenty to get through. Okay, right. So I'll kick off with recent work then. So this is going to be quite a quick tour through the first piece of research. So some of you that were at the Joining the Dots conference will have already seen this or seen bits of it at least. The work will be published on the DFT website in due course as well for those of you that want to read about it in a bit more detail. So I'll just give you a kind of quick snapshot, I suppose, today of what we did. So road safety factors. So many of you will know road safety factors have replaced contributory factors or are gradually replacing them in different forces. And these are much more aligned with the safe system now. The change has happened at different times in different forces, and that's led to different patterns in the data. And essentially what we wanted to do last year was understand what's going on with that change to road safety factors. So what are the patterns we're seeing in the data? What's the likely impacts on trend analysis, and explore the reasons for that. So that was the old contributory factors. These are the new road safety factors. Many of you will have seen this lovely diagram before, which basically tells us that there is a mapping from the old system of assigning contributory factors to collisions to the new system of assigning road safety factors. And to make it a bit more explicit, as an example, so on the right hand side here, we've got some of the new road safety factors that sit in that speed category. On the left hand side, we've got the old contributory factors that map into those new road safety factors. So you can see in some cases pretty similar. Exceeding the speed limit is now exceeding the speed limit. In some cases, small differences. So what used to be following too close, aggressive driving, or careless, reckless in a hurry is now aggressive, dangerous, or reckless. But the important point here is that there's a mapping from the old system to the new system. So what we wanted to do really is investigate that change. So see what impacts that's having on recording, look at trend analysis to see if you can see where we've moved from contributory factors to road safety factors, and look at any notable variation in reporting between forces and factor groups. And then also talking to specific forces to get their opinion on the change. Are they capturing road safety factors as intended? Is that clear to them? Were they aware that that change was coming in and the purpose of that change? Those kind of things. So for the quantitative analysis that we did, essentially we compared 2022 with 2024. So we looked at 2022 contributory factor data in the old system, and we compare that with 2024 road safety factor data for the forces where that existed in the new system. And crucially, we converted the 2022 contributory factor data into road safety factors to enable that direct comparison. And we did that according to the mapping that I've previously presented. And we found some quite interesting things. So I'm not going to talk through this in any detail today, but this is just to give you some headlines really, and then you can look at the detail in due course on the DFT website. But looking at the groups of road safety factors, we saw some interesting differences between 2022 and 2024. In particular, the proportion of factors relating to speed nationally has gone down. The proportion of factors related to non-motorized road users has gone up. That was an interesting finding. We then dug into why that might be the case by looking at the specific factors. And we also looked at whether this was happening individual force level, and broadly speaking, for individual forces, this was a similar pattern. So that was the quantitative analysis, and this was probably the headline finding from that. And we then did some qualitative analysis. So we talked to forces to try and understand what's going on with road safety factors in general. Were they happy with the change? Did it make sense, etc.? And then also specifically to dig into why we might be seeing some of those changes on the previous slide. Quite a few interesting responses that have led to some interesting hypotheses for us, but obviously a small sample size at this point, so it's difficult to say with any kind of definiteness. People commented on these changes may be reflecting genuine changes in road use, technological advances, different attitudes amongst forces that were reporting these factors, but also the change to road safety factors has maybe meant reordering of group or grouping of different factors. So they look different on the screen, they're ordered in a different way. Those kind of things are all impacting which factors are being selected. Officers also commented on the implications of selecting certain factors and the potential desire to avoid extra workload. So if selecting a factor might lead to prosecution proceedings or a lot of administration or a long kind of drawn out process, then that might make an officer less likely to want to tick that factor. And so minor wording changes can make quite a big difference in terms of the selection. So to wrap up then, takeaways for the Department for Transport on this. So this is adding to what will be the guidance on the website relating to STATS19. On the right hand side here, you've got a screenshot of the work we did last year and a link to that. We'll put that link in the chat as well as we go so that you can see that. So this road safety factors research just adds to that guidance, and that'll be published later in the year. And a number of follow-up actions are being taken forward by the team, including looking to improve the national training on STATS19 data and why it's important, looking at particular aspects of road safety factors, how to interpret those, and more regular dialogue with police forces to engage and understand issues and challenges that they are having. Okay, right, I'm going to pass to Matthew to talk about some more recent work on linking police and hospital data. Over to you, Matthew.
Thank you, Nathan. And we're going to do the next slide, please, bit here in a minute. So, yeah, this is just an update on what's very much work in progress within the DFT and beyond. As it says there, linking police and hospital data. So I will give an update where we got to. We have made some progress. There's still a lot more to do. If anyone's interested in this and wants to get into the detail beyond what I can cover in the time here, then please do reach out to us, and we're very very keen to explore the value of this work. So by way of background, hopefully the sort of the logic here is familiar. STATS19, as we know, is a very valuable data set, but does not capture all non-fatal casualties or collisions. Some are not reported, and it doesn't have much on what happens to casualties post-crash. There are healthcare data sets, hospital admissions and the like that can address these limitations. So by linking police and hospital data, we can hopefully have the best of both worlds. This has been hard to achieve in the past, but there was some work, I think it was last year, that the report was published by the RSGB Foundation, which set out the challenges and has set us on the road to overcoming them, with a lot of work outside the DFT as well as within. That has led through into a commitment in the road safety strategy, which you may have seen. Hopefully you've seen the strategy, but you may have seen the page there, which sets out the commitment to linking police and hospital data through this PRANA network, the Pre-Hospital Research and Audit Network, led by the University Hospital Southampton, with TRL involved as well. Within that wider project, what we're calling LPHD, linking police and hospital data, is the DFT-led work, which I will briefly describe now. So if you can move to the next one, please, Nathan. So for this specific bit of the work, these are the aims and objectives: to get the STATS19 and health data into an environment where they can be linked, which needs to be sufficiently secure, to test out whether it's possible to actually make a reliable linkage of the data sets, which is not trivial because there's no common identifier, and then to see what we can do with the resulting linked data. What does it tell us about the completeness and quality of STATS19, and what new insights might it provide? We're taking a phased approach. Phase 1 was a small scale study which has been published. There's a link there if you want to explore that later if you've not seen it. Phase 2 is what I'm going to talk about briefly here, and this is a work in progress, and there's a lot more to do on this. So we're at the start of quite a long road, but we have at least made a start. So Nathan, if you move to the next, we'll go through yes, this is just to set out the vision of this LPHD project. So we've got STATS19 is the blue blob there, that's the STATS19 data set, and then these green, what color that is, blobs are the various healthcare data sets. So we've got ambulance data, we've got emergency department A&E data, then we've got what's sometimes called HERS, inpatient data, and then various other bits and bobs as well. So if you click through, this is going to be a few clicks. So phase 1 is, again, what we've, hang on, careful. Phase 1 is what we've done so far, which is linking to ambulance data, and that is relatively straightforward as far as these things go, because both police and ambulance data have location, so that's really useful for matching them. So that was successful, but there's not a national ambulance service data set yet. So we've moved on to phase 2. Click, yes, thank you, which is linking to these other health data sets directly. So no location here, but we've got postcode and various other things that we can use for a fuzzy match. I will talk a little bit more about that in a moment. This has the benefit that the data exists for the whole of England, and there is a time series of 25 years. So if we can pull off the linkage, we've got a potentially quite rich data set to explore. And then the phase 3, the final thing, is then to link everything through the health system and see what happens when people are in a collision. How do they progress through from the ambulance to the A&E into a hospital bed, and then we'll follow up. And there's a lot of potential for analysis, but we're not quite there with that yet. So that's the vision. Next one, please. I won't say too much about this. There will be a publication, hopefully by the summer. We'll come back to why July in a moment, that will set out more detail. Suffice to say that we have made some progress in developing a fuzzy matching. It's not perfect, but it is, I think, fit for purpose. Welcome anyone who wants to get involved in exploring the details. And of something like over 1 million hospital inpatient records related to road transport incidents, of which 800,000 are RTCs over the past 25 years, roughly. We've linked half of them to STATS19. There will be some inaccuracies in the way the matching is done, but there will also be a lot of collisions that are in, or casualties that are in patients in hospital that are not reported to STATS19, and we'll just explore that in a moment. So I won't go through this in detail. Let's move on to the next bit. do come back to me if you want to know more about the methods. So these are some of the initial findings, and I would say provisional, very much a work in progress and subject to further quality assurance. But let's just rattle through a couple of things. So this is the rate of linkage. So that chart shows by length of stay in hospital what proportion of RTC inpatients are linked to STATS19. So overall, it's about half. It's higher when the people stay in hospital longer, so more severe injuries, generally speaking, a bit broad proxy, is lower when it's shorter stays in hospital. So that's not surprising. It's in line with previous work. And there's a declining trend over time. Needs a lot more work to understand what's going on with that. But that's the first one. So next slide. This is now broken down by road user type. So this is the proportion of inpatients in the hospital data that are linked to STATS19 by road user type. So it's higher for pedestrians, about 2/3, lower for pedal cyclists, about 1/4, and bus casualties as well. So if we move on to the next one, we'll see why that is. So this is now, and apologies, a bit of a whistle stop, this is now broken down by the type of collision. So in the columns there, you've got whether the casualty in the was in collision with a motor vehicle, with a non-motor vehicle, so a pedal cycle, a pedestrian, something else, or nothing at all. So if you just highlight, Nathan, a couple of things, I think 2 clicks here. When they're in collision with a motor vehicle, which is that first column, there's a much higher rate of linkage, so much more likely to be in STATS19 is the conclusion from that. When there's no vehicle in the collision, particularly with a pedal cycle or a bus, so someone falls over in a bus or falls off a pedal cycle, the rates of appearing in STATS19 are much lower. It's not surprising, but it gives us a way to quantify some of these things that we've long known. Next one. So that was just a few things that we've looked at so far. These were the conclusions from that, which is basically what I've just said. We need to do a lot more work to explore the value of this data and the quality. Any suggestions are welcome. Let's move to the next. And then this is just to say, yes, as I said, it's a work in progress. We've got a lot more plans to work on this, not just us, TRL and others are involved in this. I've described what we're doing here. I think, so the immediate next things, the last bit there to look at, compare the police recording of injuries with what happens in the hospital data, see if we can develop some new measures of clinical severity based on the hospital data, and then look at ways that this can feed in and support the new strategy. So there's things that are available in the health data that aren't in STATS19, such as ethnicity. It'll give us a lot more insight into what happens and the cost of collisions, how many interactions people have with the health system, and the road safety investigation branch, or whatever it's going to be called, will be very interested in understanding collision risks. So there's a lot of value, hopefully, and we made a start, but a long way to go. So I think that was me done.
Yes, thank you, Matthew. Great. Would thoroughly recommend, if you want more detail here, watch the recording back on half speed, pause the slides, and ponder what's being said. Right, this should be loading. It appears to be not loading. There we go. Right, so hopefully you can see a question on Mentimeter. If you've not already gone to Mentimeter, then menti.com, the link is in the chat. Use the code 31869867, and this is the first of the questions we've got for you. So yeah, is the recent work on road safety factors of interest or use to you? A simple one to start with. Yes, no, and not sure. We've got 90 people on the call, so and I think 63 of you have managed to get into Mentimeter. That's great. We'll just give it 30 more seconds for people to log in. So yeah, the link is in the chat to menti.com, then 31869867. Right, was it pretty conclusive? Everyone's being polite here. I guess this is a nod, Matthew, to get something published on this in the next month or two.
Yeah, thank you. And you are able to disagree with us or with them. You know, you can say no if that's what you think. But yeah, very unanimous, I would say. Thank you. Really useful.
Cool. Okay, we'll move on to the next one. So, on the linked hospital data, would you be interested in accessing results of the linked hospital data? So it's a yes, I'd love some detailed data. Yes, but high level data would be fine. And no, this is linked hospital data for your area. I guess if you're not here from a local authority or a particular area, then this is accessing results more generally, maybe a national picture. Ten more seconds. Great, I think that paints a pretty clear picture. Right, next question. So pick one of these. So this is which area would you like us to study next? So we obviously looked at road safety factors. Last year, we did some work looking at reporting trends, and there's also the work on data linking. So we've got 7 options here that could potentially be studied next. So there's severity, looking at reliability of data relating to severity and regional trends, data linking, how to make that effective for end users, the impacts of online reporting on data collection, the impacts of different reporting systems on data collection, benchmarking and comparison between forces, for example, how to do that well, agreement between national and local data, so I mean that's the forces and authorities are using as kind of their ground truth, or something else entirely. So one of those, please, on an area to study next, if anything at all. I'll give it 10 more seconds. Okay. Seems like there's a winner and a joint second on this one. Okay, right. And then last question for this section. This is a free text question. Are there any other areas that you feel we could investigate? So you're not giving you options this time, but feel free to type in. And whatever you type in will appear on the screen. So just note that when you type. Just give it a minute, but any free text answers to this one. Correct answer. Thank you. Yeah, or if you want to elaborate on what was on the previous slide, in terms of a bit more detail around severity, data linking, online reporting, something else, then that's also helpful here. Great. Okay. We'll keep all this data after. It's only showing the top 12 on the screen. Yeah, feel free to keep putting it in, and we'll feed it to Matthew and team after. It'll all be useful information. I'll let you know about clicking to group responses that it might remove them, so we're not going to do that at this point. Okay, right. 10 more seconds for anyone who wants to type any last stuff in, and then we'll move on. Okay, great. I can see we've got 81 people on Menti now, so that's great. So there'll be 2 more sets of questions coming up in the next sections. Right, okay. So let's move on to publication plans for 2025, and I believe I'm passing to you, Megan, for this one.
You are indeed. Alrighty, thanks, Nathan. So I'll be talking you through our publication timeline for the 2025 data, how our analysis will be supporting the new road safety strategy, and also be covering some areas we're looking to develop where we'd really value your views. I'll finish my section with a few quick commenting meter questions, like the last section, to help us understand where you as the community and our users would like us to focus on going forward. Next slide, please, Nathan. Thank you. So the publication timeline this year, as Matthew alluded to, the biggest change is we're bringing forward the main STATS19 publication, with much more content landing in July instead of September. So right now we're in the process of finalising the 2025 data, and we'll be writing out to data providers in mid-May with the final totals. And at the end of May, the provisional 2025 publication will be published as usual. In mid-June, the database will close to amendments. This is earlier than last year, so if you are a force with outstanding data, please send it across to us as soon as possible. And if you're a local authority that cares about your figures matching ours, now is the time to engage with us. In July, we plan to publish the final data and main report in a chapter-based format. The majority of the data tables will also be published. We'll be updating existing fact sheets with 2025 data. The open data and interactive data tools will be updated as well. And we'll also be adding a new chapter on safety performance indicators. More on that coming up. Then September becomes more about value-added analysis. So new topics, deeper dives, improvements to existing products, etc. And these changes to our timeline are very deliberate. They improve the timeliness of our statistics and also help support the strategy as well. Next slide, please. Thank you very much. So as a bit of context to the strategy, for those not familiar with it or less familiar with it, the case change is really clear. 30,000 people were killed or seriously injured on roads in Great Britain in 2024, and 8% of those were children. The new road safety strategy sets ambitious targets out to 2035, there we go, for reducing the number of people killed or seriously injured on roads in Great Britain. So a 65% reduction in overall KSIs and a 70% reduction in under 16 KSIs. The ambition of these targets is, I think, really nicely shown by the graph on this slide, showing the current trajectory of KSIs and where we'd like to get to meet, where we need to get to meet these targets as well. A crucial part of delivering the strategy is monitoring progress against the targets. Safety performance indicators will be used to identify potential areas requiring further action. So more on that now. Next slide, please, Nathan. So as I previously mentioned, the July publication will include a dedicated chapter on SPIs. These indicators cover both outcomes, like fatalities and serious injuries, and also underlying drivers of risk, such as speed, ineffective observation, and seatbelt use. 14 out of the 17 SPIs rely on STATS19 data, which means our statistics sit right at the heart of monitoring. The SPI chapter will sit independent of policy commentary, so our role as statisticians is to present the data transparently, explain trends and limitations, and enable others to use it effectively. We're also exploring supporting this with an interactive data tool, so users can explore the indicators at regional or local levels or different breakdowns. Next slide, please. Lovely. So alongside the SPI chapter, there are also some improvements to fact sheets and chapters that we're looking looking to deliver over the summer, ready for September publication. First is introducing a new child casualty fact sheet reflecting the strategy's focus on childcare size. Second, we're looking to bring together the older and younger driver analysis. Currently, this sits in two separate fact sheets, so we'd like to combine them to allow for a much more coherent comparison across age groups and risk profiles. And third is improvements to the deprivation fact sheet. So the fact sheet currently looks at deprivation using casualty home postcode at the moment, but we'd like to explore whether looking at deprivation by location of collision tells us anything different or new. And we'd also like to explore whether we can introduce more analysis on rates as well. So these are all developments we hope to progress over the summer with a view to include them in the September publication. Next is a few areas that we're looking to explore and consider rather than things that are kind of more locked in. One example is analysis looking at victims and responsible people. In France, the police assign a presumed responsible party, which enables analysis showing that a substantial share of those killed were not at fault, and that many of those are vulnerable road users. They also found that for those presumed responsible for fatal collisions, as shown in the charts on this slide, for men, speed was the main factor identified, particularly among those riding motorcycles and mopeds, and for women, inattention was the main factor. So we're planning to explore whether we can replicate something similar in Great Britain based on road safety factor assignment, but we also need to treat this with care given the sensitivity and complexity of the data. So we'll see whether it's possible. Next slide, please. Another area we're looking at is how we present risk by gender and sex. It's important to show the relative risk across sex. However, analyses that does not study each gender in turn will primarily present male risk, because the majority of fatalities in collisions in Great Britain are male, and this holds true across all age groups, as shown on the charts here. So in our analysis, the narrative by gender could be expanded further to explore specific road safety risks for both men and women, presenting the separate risk profiles for each gender in turn. Next slide. Thank you very much. Next is developing our analysis on driving for work. So last year we published experimental analysis on driving for work collisions, adjusting STATS19 journey purpose variable. We made adjustments based on vehicle type, so HGVs, buses, agricultural vehicles and trams were assumed always used for work, regardless of their recorded journey purpose. We also reclassified some journey purposes, so taxis and vans coded as commuting were reclassified as working based on the nature of their use. This work suggests work-related involvement may be close to a quarter of all collisions rather than a fifth suggested by the raw STATS19 data. However, we know this is still likely an underestimation, and so we'd like to explore ways to improve it. One example is looking at reclassifying unknown journey purposes. So for a relatively large proportion of drivers, the journey purpose is recorded as unknown, and in 2024, that was 57%. So we could estimate the number of unknown journey purposes that are likely to be driving for work based on vehicle type, and this would be similar to work TfL have recently published for London. Next slide, please. I think it's Mentimeter time. But to quickly summarise what I've covered before we turn to Mentimeter, I've covered our publication plans for this year with the main STATS19 release moving forward to July and September focusing on deeper value-added analysis. I've shown how our statistics will support the new road safety strategy, particularly through the Safety Performance Indicators chapter. And finally, I've outlined a mix of things we're already planning to deliver this summer alongside a set of exploratory areas where your views will really help shape where we prioritise next. So with that in mind, let's turn to Mentimeter.
Amazing. Megan, that was super speedy, efficient and informative. Thank you. So yeah, Mentimeter, you've got the first question on the screen here. So yeah, how important do you think it is for the DFT published figures to align with the totals that local authorities are using? Any context you want to give, Matthew, on this question and why it's in here?
So we are, as Megan said, we are now trying to finalise the 2025 figures. And so I think we've had some issues in the past with one or two areas where we might not have quite published what was aligned with the local figures. So I think it's our plea that if you've got any, if you feel strongly that you want to have our figures to align with what you've got locally, then please do let us know over the next month. And a path, as Megan said, the sooner the better. I think we have to manage expectations. We have to draw a line somewhere, because systems like Crash are live databases and we could be waiting forever for everything to come back from coroners, for example. So we never publish anything. So we have made that decision that we've got enough confidence we're going to have almost all the data by the time we draw a line. But yeah, we're very keen to hear from local authorities that feel strongly about this and work together as best we can. And I think there's a longer term thing here about where an area uses the crash system. How do we get the relationship between what we pull from the system and what goes into local databases, more joined up, if that's of interest. So that's one perhaps for further discussion. But the thing right now is, we're just about to publish. So we will be writing to forces, like I said, mid-May. So if you a local authority that's keen, we can share those totals as well. In some cases, we get the data from local authorities, so it's straightforward. But in others, it might be that we pull the data from Crash and engage with the force. So yeah, I've put the email for our team in the chat. If anyone wants to drop us a line, please do. Thank you.
Okay, 5 more seconds, last responses, then we will move on. Okay. Next one. Okay. So which of the following topics would you most like to see DFT include in future analysis? STATS19 data, I'm assuming published on the website. So you can select up to 3 here. You don't have to select 3, you don't have to select any, but up to 3 of these. So we've got further analysis on child casualties, safety performance indicators analysis, updating the older and younger driver analysis, more analysis on gender divides, developing the driving for work collision analysis, road safety factors analysis, looking at responsible parties, and then deprivation fact sheet improvements. So select up to 3 of those, please. Seeing a number of comments as well in the chat and Q&A. Thanks, Matthew, for keeping on top of those. I don't know if we'll have loads of time at the end for chat and questions, so we'll do our best. And if you guys do your best as well to answer things as we go, that would be great. Okay, we'll give it going. If I click off the screen, then it doesn't update. So it's just updated that. Great. Okay, interesting. A few front runners there. Road safety factor analysis and the older younger driver analysis coming out highest. Okay, right. Next question. Any other improvements that you think the DFT could make to the published report? So similar deal to the last free text one. Answers will appear here. We'll get the first 12 or so on the screen. But all of this feedback is useful for Matthew and team. So please feel free to go ahead and write. We'll give it a minute or so for this one. Well, Caroline, what do you mean by the mapping tool? I've seen your question in the Q&A. I'm not sure on what you mean by that. I wonder if Matthew or Megan, you can answer Helen's question about e-bikes and e-scooters in the Q&A as well. Okay, great, thank you. Give it another 30 seconds. have some email addresses up at the end for you to send further comments and thoughts to, so that Matthew and the team can pick it up. There's plenty more opportunity for feedback. Maybe 10 more seconds. The useful stuff here. Thank you very much, guys. Okay, right. On to the last section. I think we're doing pretty well on time, so that's great. And I think Matthew or David, which one is kicking this one off?
Yeah, this is going to be me for this
Great.
section. So yeah, we just jump on to the next slide, please. Excellent. Yeah, so I'm going to run through here some of our future development sort of data plans, really, and then talk through some one area in particular that is really exciting that we're working on. So on this slide, you can see several of the sort of plans we've got for STATS19 future dissemination. The big one there is in the top left, monthly provisional data. So along with what Megan outlined earlier of hoping to publish data slightly earlier, but also hoping to move to publishing data from November 2026 onwards on a more frequent basis. So instead of having a couple of provisional publications during the year and then a final main publication, we will be putting out monthly figures, provisional figures based on the data we've received so far, and then that would come into an annual publication at the end. The idea here being to just provide more timely data that can be accessed by users. There's a flag here for the Transport Data Action Plan, where the department is looking to develop APIs to make it easier to access, technical users to access our data, rather than just the big CSV files that we throw at the moment. STATS19 is on the list. Exactly how long it's going to take to come through, we will wait and see. But it is on there, so hopefully we'll get through there. And we're also keen to keep engaging with local data providers on that agreement between our data and the local data. So if you have interest in that, please get in touch. And finally, on this one, on suicides and medical episodes, we're hoping to be able to publish some additional figures on the number of road-related suicides, and also use this to help us improve the validation of STATS19, removing those figures, those collisions from STATS19, those deaths, and publishing them separately, so we have a total figure and a more accurate figure for what is the STATS19 in scope figures. And if we can move on to the next slide, please. So here is the big slide on SCRICS here. So for those of you that don't know, SCRICS is the Standing Committee on Road Injury Collision Statistics, and essentially the group that oversees STATS19, the STATS19 collection, periodic changes to this, and it's a forum for improving the collection of STATS19. We're still currently implementing the results of the last STATS19 review that was conducted by SCRICS in 2018. There's no plans for the next review at this stage, but we are open to any minor suggestions, minor improvements. I know it's been mentioned in the chat about e-bikes. That's definitely something we are discussing with SCRICS and keen to look into. And you can see at the bottom there several of the current areas of interest, and one that is of key interest that's been highlighted in the strategy side is the classification. So if you can just move on to the next section. Oh, sorry, just final flag on SCRICS. If you're not a member and you are interested in contributing to the STATS19, please get in touch with us, and we can look to add you to the list. So what I'm going to talk through here is one of the areas SCRICS is looking at in relation to the rural roads and in relation to where do collisions in STATS19 happen. So one of the key questions we have around the data at the moment is where are collisions. We get a point location. You can see the screenshot at the bottom there is the data that we currently get on collisions in terms of where they are. We have an east, and a north, and a little bit of data on the types of roads that those collisions are, but we don't have particularly good validation on that road information, whether or not it is accurate for the collision. And also, this is not particularly useful when it comes to assessing the risk of a particular section of network. We've only got point locations. We don't actually understand where on the network a collision is happening. So what we are trying to do at the moment is to connect all of the STATS19 collision data to a road network so we can validate this information and also add more context around where collisions happen. So if we move to the next slide, please. So the first question we've had to answer for this is, what road network do we want to match to? So what we are using for this is the OS Highways road link data set, and I'll pop the link in the chat, hopefully that I've got on the slide there, to the data about this. What this is an incredibly feature-rich data set. I don't need to go through that boring definition, but that is what a road link is defined as by Ordnance Survey. And what this data set has is 8.5 million segments of road across the whole of GB. You can see the map GB at the bottom. That is all of the road links. It's quite a dense data set. We've chosen to link to this because it's very feature rich. It's got lots of information about the types of roads, where they are, and it's available as part of the public sector geospatial agreement to all public sector users. So if we just move on to the next slide, please. And then if you just click a couple of times, I think there should be 4 images that pop up on here. So why are we doing this? As I said, it's partly just to validate the data. So the first part of this is, you can see there's several collisions here, the little pink dots that you can see on the screen here, where those collisions happen. These aren't always actually in the place where the collisions should be. So we're able to use the road network to help us identify these collisions that are not on a road, and go back to forces, improve this data, and move them to the road. And also sometimes they're on roads that the information doesn't seem to match. So that one at the bottom there is apparently on an A road, but you can see it's actually a very small road. This allows us to identify these collisions and hopefully flag them. If we move on to the next slide, please. So this is just another example here. This is all the collisions from the last year that are not within 25 meters of the road, and another example here of one that's claims to be on an A road, but actually all of the links are in B roads or unclassified roads that are nearby this. And we're doing this by scanning all of the links from that road network that are within 25 meters of the reported collision location. And if we just move on to the next slide, keep rattling through this. What we're then doing for the next step is trying to identify which of those links within 25 meters is the most likely to be the correct link. So you can see here, I've got 2 examples, which I'll just quickly talk through, where you've got sort of multi-layered bits of road, lots of links coming on top of each other, and we're using information about the road number, road class, road type to identify which of those links, as well as the distance of that link from the point, is likely to be the correct one. So blue there is best, red is the worst links. And we can see this actually works really well, even in sort of complex areas of network. And we're currently snapping 99% of collisions to a network successfully. Would you jump onto the next slide, please? So why are we doing this? A big application of it is rural roads. We're keen to understand the risk of different types of rural roads better. This is set out in the strategy in that green bubble. I've taken the relevant section from the recent published strategy about rural roads of what we're trying to do here. And we're about to kick off some work with Agilysis to try and classify the rural road network better. This snapping will then allow us to hopefully identify how many collisions happen on the different types of roads in rural areas. And if we move on to the next slide, I think there should be one more. Yes, so this is just very quickly, this is the roadmap of what we're trying to do. At the moment, feasibility work on the snapping, then we kick off the rural road work. By the middle of 2026, we're hoping to use this snapping to inform the monthly validation of the 2026 collision data that we'll be doing with forces, so highlighting those collisions not near roads or near potentially the wrong roads. When we publish results in the summer, in September, we're hoping to give some initial analysis on the results of the snapping, and by July next year, when we're finally saying the 2026, we hope to include full results from this snapping. So ideally, we'd be publishing what link collisions are happening on and what type of rural road we're on. That's the plan. We'll see if we can get there. I think I've hopefully rattled through everything done there for the fundamental questions next.
Yes, amazing. Great job, David. I told you this was going to be fast paced. And actually, when you say kicking off the rural road stuff, so I mean, it's literally today, right? You're about to head in for a meeting to kick that off this afternoon. Cool. Yeah, please get in touch with the team. I'm sure that's what you'd have said. Okay, last set of questions then. So, do you support plans to publish available provisional data more regularly or not? So, do you think it's a great idea? Do you not have any strong feelings about it? Or is it not a good idea? Either positive or neutral so far. I'll give it 10 more seconds for last few answers to filter through. Okay. Next question. So this one might take a little bit longer because we want you to rank these. So can you please prioritize these things in terms of which would be most valuable? We've got linking to death registrations to understand road-related suicides, better e-bike recording, improved rural roads classification, analysis on vehicle weight and size, analysis of linked hospital data, data on ethnicities from crash data, better autonomous vehicle recording, and significance testing, so statistical significance testing on STATS19 data. So you should, on your screen, be able to rank these from top to bottom, and then what will be presented on my screen is a kind of average ranking from all of your answers. So I'll give you a couple of minutes to do that. I think it will change quite a lot as the first few answers come in, and then as the sample size gets bigger, it will hopefully stabilize. We'll see. Great stuff. Thank you. We've got 30 responses in now. Okay. Seem to be two fairly clear groups of 4 here, 4 that are more popular and 4 that are less popular. I'll give it 10 more seconds just to finish up. And we've got one last question. Okay, last question. Right, another free text one. Any other changes? This is a bit of a catch-all, I suppose. Anything you've not said yet in the presentation? Any other changes to STATS19 or DFT stats that you would like to see in the future that we've not already talked about? Or indeed any additional detail you'd like to add on things that have been talked about? While the answers are coming into this, Matthew and team, is there any reflections on what's been put in or what's been said today that you'd like to somewhat conclude with?
I think it's been really helpful for us to see this feedback. It's generally seems like most of the things we're doing are not mad. People are either supportive or not feeling strongly we're doing the wrong thing. So that's great for us to know. And a lot of the things that have been mentioned or come up are things that we are trying to work on. We've already sort of got on the radar. So I think that's probably quite reassuring. So e-bikes, definitely, electric vehicles, those sort of things. Some of them are not so easy for us to get data for or to tackle. So we are trying our best, but yeah, I have to manage expectations a little bit of what we can do. The three of us here and a small team in DFT. Making changes to systems, even ones like Crash that are within the department's control, can be, can take time. So I think, yeah, it's great to have these things. We will do our best to progress them. But yeah, definitely welcome all the feedback, even if we can't just go out and solve all the problems immediately.
Okay.
And sorry, the final thing, yeah, as we've said several times, if you want to reach out to us with more detail or have a chat, yeah, we're absolutely keen to do that.
Right, 10 more seconds on this, and then we will wrap up. I'll get an email address on the screen for you so you can get in touch if you've got any more questions. Okay, great. That was one of the speediest webinars I think I've ever been part of. Hopefully that was useful. It was very much designed to be a quick tour through lots of different things to give you an update. We thought it was a good time of year to look at STATS19, update you on various different things that are happening, look ahead to publications and future plans. Here are 2 email addresses on the screen that you can use with any further comments or suggestions, so feel free to get in touch. Fab. I haven't been keeping much of an eye on the chat and the Q&A, to be honest. Let's stop sharing my screen now. Anything, Matthew, you want to pick up on?
I think I've answered everything in the chat. If I've not, then we will pick it up later. As I say, do drop us a line if there's anything you want to explore in more detail. But I think I've got everything at least answered, even if it's not really an answer sort of answer. So I think we're good.
Great. Okay. I will I'll have a look through the chat after this, and I'll also put a link to the research that we shared from last year in the chat as well before we close the webinar down. Okay, great. Wow. That has run surprisingly well for time. Thank you everyone for your participation. Please do get in touch with Matthew and team or with me at Agilysis if you've got any questions, thoughts, anything else you want to add. The recording for this webinar will be available on the Agilysis website and on YouTube after. And again, we'll put a link to that in the chat. There is a link already at the top of the chat. Cool. Stay safe out there. Have a great day. Enjoy the sunshine if it's sunny near you, and we'll catch up again soon.
Thank you.
Thanks all.